we are all concerned about this very important and interesting obstetrics question. This presentation is going to be on an integrative patient-led approach. I think that it is very important to have a patient-led approach because we all know that without it, all you have is a doctor.
You have to say next slide.
Next slide, please. If I stare long enough. So, when dealing with the internet cat obstetrics, you will deal with a separate set of issues than with human obstetrics, and there is documentation for the differences between the two. If you do want, after this presentation, to see the documentation, I have an 86-page report that is available to you via microfilm. Now, when we are talking about internet cat obstetrics, we notice that it is very resin-based. There is an entire field of study devoted to resin-based internet cat obstetrics. But for right now, we're going to focus on human obstetrics. If you notice here, this is a human, which is a subcategory of people. The cat is also a subcategory of people, but like I said, we're focusing on the human. It is very important to take selfies of oneself during the pregnancy process because it encourages fetal movement. Next slide, please. All right. This doctor obviously is doing it wrong. You have to really take into account that when people or humans or internet cats need obstetric care, that sometimes they don't know what they're doing. They just suddenly wake up one day and they start taking selfies of themselves and go to see a doctor, and the doctor will say, well, how long have you been taking selfies of yourself and your belly in the mirror? And they can guarantee within a couple of days when the birth is going to take place based off of when the selfie started. This here is a cartoon, a humorous cartoon, showing the different tools that are necessary to obstetrics. This, although it is a human, falls more into the people category because this is a specific tool used for the giving of birth to internet cats. It is confusing, I just wanted to explain this. Yes?
I'm sorry, I'm a little bit confused about the selfies. Is the selfies like something that you do to help encourage the pregnancy to happen, or is it something that is just an indication that you're
It's pregnant? A naturally occurring phenomena. We do not have any medical documentation of why. We just know that when the selfies of your belly start happening, it's a good indicator of pregnancy. But human pregnancy, not internet cat pregnancy. There's a whole different indicators.
But it's specifically the belly.
Yes.
Oh, okay.
Yes.
Okay.
Well, picture of self and belly, usually highlighting belly, and nowhere else you will find people taking pictures of their belly, unless false pregnancy. There are some men who are on steroids in the gym and suddenly feel the need to take pictures of their abdominal regions in the selfie position, but we found that it's false pregnancy due to steroids.
Is that the case even when there's a chest burster coming out?
No. That is an entirely different case, and it falls under a separate from internet cat or human.
Okay.
Next slide, please. So, as I was saying, there are some times where pictures of male bellies take place. This gentleman is going through what we term as induced pain to try to understand the process that pregnant women are going through. This is fringe. It's not as common as the false pregnancy steroid ab selfies, but it does happen, a very small subset of men inducing pain. This gentleman is obviously doing it around Christmas, and he forgot to take off his party hat. Over here we have fairy birth. Fairy birth, this is an example of the internet cat. When it comes out, it will be an internet cat. This is where the generation of all internet cats come from. Can I have the next slide, please? So, we need to have some base medical graphs for you and pictures. This is a human pelvis region, and this is where the baby will be. And as you notice, it is just the bone and sort of muscle structure. You must try to use your imagination and understand that there will be skin and tissue over this when the baby is there. There are certain medical things you should stay away from. This is catnip. We don't advise catnip for any internet cat births. It stunts the growth of the internet cat fetus. Here's a lovely graph indicating how often selfies take place during the pregnancy process. Can I have the next slide, please? So once the birth has taken place, you want to refer to your nurse practitioner midwife or your doctor or your doula for aftercare. It is very important to have aftercare after birth. And if you don't check in frequently with your doula or your nurse practitioner midwife or your doctor, dragons will come to eat your child. Next slide, please. So, should you trust your doctor? Choosing a doctor is very important. It's a very intimate relationship that you have with the person that's going to, catch your child or your cat. There are different doctors you can choose, and they all have a range of styles. So you need to pick the doctor that works best for you. For instance, I would recommend Dr. Octopus for any internet cat deliveries, especially if it's a litter. All the extra hands help with litter births. If you are expecting a particularly gifted child, you might want to choose Dr. Strange. He could recommend places for your gifted child to go should they prove difficult. Dr. Huxtable has very good success with long hoagie sandwich births. These are not common. If you have one of these strange births, you will realize it because when you take your selfies, it will be a strange outing instead of rounding. But anyway, if you have any questions, my 86 page report will have information on each of the doctors. And I would like to point out here is another tool that is specifically used for internet cat birthing. If you are interested, there'll be another whole slide dealing with specifically, yes?
What about the doctor?
The doctor? Well, the doctor is great for births if you are, if you have become pregnant when you are inside a time machine. Like, that is his specialty, because there's a whole nother set of complications for time births. Next slide, please. So, when you visit your nurse practitioner or other medical facilities, they're going to have you fill out a survey. It's very much like a Mad Lib. So what you need to do is you need to focus on the answers before you read the survey. That is your best indicator of filling it out correctly. People are often scared by it. Don't be scared by it. If you have had multiple births, you'll realize this is a piece of cake. Next slide, please. So,
which is the most horrifying?
If this is your second or third birth, sometimes you have to help your children realize what's going on, and they will have questions, and the best way to do it is not any of these ways. So in conclusion, you do not want to risk your kitten litters, your human litter, your people litters, to the many and varied complications of delivery and the birthing process. So what I would do is suggest, as soon as you find out that you're taking selfies of your belly, to meet with your medical practitioner, and it will reduce all of these complications by half, especially the confusion. And if you are male and taking the selfies, you might want to go off the steroids. Thank you very much.